Okay, student, a very good morning once again. How are you all? How are you all doing? Okay. Yesterday, what I taught you all? Anyone remember yesterday what I taught? Say, against Highland. Yesterday, what I taught?
UTI.
Yes, urinary tract infection. While explaining, if I keep quiet, how will you feel? You will understand. Okay, let us rewind back to yesterday what we have explained. Can anyone tell me the definition of urinary tract infection, which I already explained yesterday? Because today I will be teaching you all the clinical manifestation as well as the diagnostic evaluation. So before continuing into clinical manifestation, I would like to ask you all about urinary tract infection definition, which I have already discussed yesterday. Anyone? Urinary tract infection? Anyone? Anyone, what is urinary tract infection? Anyone? Shital, tell me, what is urinary tract infection? I already taught yesterday. If you don't even know the meaning, how will I continue?
Infection.
Yes, in any part of what?
Urinary system.
Yes, in our
involving kidney, bladder, and ureter and urethra.
Yeah, very good. If you know, then don't keep quiet. Okay, it's very good. Shital, very good. And Surajit, who are more susceptible to this infection? The woman or the man are more susceptible to this infection? Surajit. Women are at greater risk of developing upper urinary tract infection or else men? Surajit, sleeping? I can't hear you properly. Ilasara, tell me. Women are greater risks or men are at greater risks of developing urinary tract infection? Ilasara, hurry up.
Women.
Okay, very good. Okay. This one, we are rewinding back. You just see nicely. Tomorrow I'll be completing this and I will be sending you PDF. Tomorrow I will send, I won't send today. Likha is joining now. I told to join at 9:15 and okay. After definition, what did we discuss yesterday? Srijana, what we discussed yesterday?
Ma'am, classification.
Yes, classification. Okay. Samuel, tell me the classification. How many classification we discussed?
Ma'am, 2.
Well, what were they?
Upper urinary.
Yes, upper
Upper
urinary.
urinary.
Yes,
Lower urinary.
Okay. Then Malvina. Is Malvina present? Malvina, tell me, in upper urinary tract, it is composed of what? Upper urinary tract infection is composed of what? Malvina.
Kidney and ureter.
Yes, ureter. Yes, very good. Okay. Okay. Yatu is present. Yatu, are you there? Yatu? Is yet? Bishal, tell me. In lower urinary tract infection, lower urinary tract is composed of what? Tell me. Bishal, tell me. Lower urinary tract consists of what? Tell me. Hurry up. Tell me, if you don't know all these things, how can I continue to clinical manifestation? Okay, Srijana, tell me.
Yes, ma'am.
Yes, tell me what in lower urinary tract, it is consists of what?
Yes, ma'am.
Bladder and urethra.
Bladder and urethra. Okay. Yatu is present? Yatu?
Yes, ma'am.
Okay. Yatu, if there is infections in the kidney, then it is known as what? It is known as what?
Cystitis, urethritis.
Samuel, is it correct? If there is infection in the kidney,
No, ma'am.
it is what?
No,
It
ma'am.
is.
No, ma'am. Sorry.
Yeah. Say. What is the answer? You say fast. What is the answer? Pyelonephritis. Okay. Very good. Okay.
Sorry, I thought lower one.
Okay. It's okay. Monica, tell me if there is infection in the lower urinary tract, that is, if our urethra is affected, it is known as what? Infection that occur in the urethra is known as what? Monica. Urethra. Agar urethra में infection what? Or that particular term, that particular medical term was what? You tell me.
Ma'am, urethra.
Rudolph is joining now.
Urethra.
Who is latecomer? Yes. Urethra. If there is infection in the urethra, it is known as?
Urethra.
Yeah, urethritis. Okay. It is known as urethritis. Okay. Ishan, tell me, if there is infection in the bladder, it is known as what? Ishan, tell me, hurry up.
Cystitis, ma'am.
Yes, cystitis. Very good. Cystitis. Okay. Okay, that means you all are clear about it, right? Okay, this was the one and this was the one. Okay. Now I'll be discussing the most common causes of urinary tract infection, which I already explained yesterday, isn't it? I have given you so many bacteria. Then among all those bacteria, what was the most common bacteria that I had given you? Means I had given you all, Klebsiella, Pseudomonas, Enterobacter, Proteus, Staphylococcus, so many things I have given you all. Among all those, which was the most common bacteria that caused the urinary tract infection? Anyone?
E. coli, ma'am.
Yes, E. coli. Very good. E. coli, in short, it is known as E. coli. That E stand for what? E stand for? Sheetal, E stand for?
Ma'am, I cannot pronounce properly.
Okay. Can you please tell me the spelling?
E.
Yes.
Scherichia.
Very good. This is Escherichia. Okay. Escherichia coli. And simply, if you can't pronounce it nicely, you just memorize the spelling, and then you just pronounce it as E. coli. Okay. Very good. Okay, the etiology is done. Then after that, I have already discussed about the risk factor of urinary tract infection, isn't it? There was like, we find inability or failure to empty the bladder completely. Where in urinary tract infection we find, did we find or what, that there was inability or failure to empty the bladder completely? Was the bladder empty completely or incompletely in urinary tract infection? In the first risk factor, yesterday I discussed. The bladder was empty completely or incompletely? Srijana?
Completely.
Ma'am, incompletely.
Incompletely, yes. That's why I have given you all in the first point, isn't it? Inability or failure to empty the bladder completely. Okay. Was catheterization the risk factor of UTI? Was catheterization the risk factor of UTI? Anyone? Catheterization. Was catheterization the risk factor of UTI? Yes or no?
Yes.
Okay. Yes, catheterization was also the risk factor of UTI. Okay. Can anyone tell me one risk factor of UTI, which I did not mention apart from these two? It's very common. I already explained about the man also. If the man is over how many age? Like the man over how many years of age he is? 60 years.
60
Very good.
years.
Yes, yes, 60 years. 60 years of age. If he is over 60 years of age, he will have the higher risk for developing urinary tract infection. So why? Do you know why? Why men over 60 years? Why not 40, 50 years? Why 60 years they will have a higher risk for urinary tract infection? You know, not the prostate means like what happened is that in many men, now those who are above 60 years of age, 60 years of age, we find there is enlargement of prostate. Enlarged prostate occur in those who are above 60 years of age. Not in everyone, but those who have urinary tract infection. Above 60 years of age, they have like enlarged prostate. And if their prostate is enlarged, what will happen is that may slow and incomplete bladder emptying. Means to empty the bladder, that because of the enlarged prostate, it will slow down. It will slow down the bladder for emptying. That was the like reason why we mainly mentioned about men over 60 years of age. And I also mentioned about that now, like women or men who are sexually active seems to have higher risks of UTI. Single sex partner I mentioned, or multiple sex partner did I mention? Samuel, tell me.
Multiple, ma'am.
Yes, multiple sex partner. No, women who have become sexually active, like I already mentioned, na, those who are prostitute and all, like they have multiple sex partner now. All those are very much susceptible to have this urinary tract infection. Okay. I mentioned one surgery is not it. What was the name of that surgery that increases the risk of urinary tract infection? I mentioned one surgery. If a patient undergo that particular surgery, he will have an increased risk of developing urinary tract infection. What was the name of that surgery that I mentioned? Prakriti.
Urologic.
Urologic.
What's that? Say. Correct. You say. Any one of you can say. What? Microscopic surgery or else what? What did I mention yesterday?
Urologic, ma'am.
Yes, urologic surgery.
Urologic, ma'am.
Yes, very good. And I also mentioned now patient with chronic diseases. What type of chronic diseases did I mainly mention? What type of chronic diseases did I mainly mention?
Diabetes.
Oh, yes, diabetes. Okay. Okay, very good. That was all about the revisions that we have explained yesterday. And today I will be discussing you all about the clinical features of urinary tract infection. Is the screen visible to everyone? Can you see the screen?
Yes, ma'am.
Okay. Yes. Clinical features of urinary tract infection. I already had given you all this, you know, like the first point is dysuria. D-Y-S-U-R-I-A, dysuria. I had given you all, I think, now before, some of the important terms that we use in urinary system. I had given you some abbreviation. I had given you now before, anorexia, all those, anuria, oliguria, all those I had given you. At that time, I had also mentioned or included about dysuria. Dysuria, D-Y-S-U-R-I-A. Ilasara, what is dysuria? This is the first clinical features of urinary tract infection, dysuria.
Burning sensation during
Yes.
micturition.
Very good. Burning sensation during micturition. This is the first point. Dysuria. You can also coin it like while micturition. Micturition means urination. Okay, don't get confused. Micturition means urinations, means while you urinate, there will be a painful or else difficulty in urinating, or there will be like a burning sensations during micturition. And that particular term is known as dysuria. And this is the first clinical features. And next is suprapubic pain and discomfort. In the pubic region, in the woman, in pubic region, there will be suprapubic pain and there will be discomfort. Means our pubic region, I hope everyone knows this. And pubic region, there will be suprapubic pain as well as, not only pain, as well as there will also be discomfort. This is the second point. Next is microscopic or gross hematuria. What is hematuria? What is hematuria? Ishan, what is hematuria? Ishan, what is hematuria?
Presence of blood.
In the
Presence of blood in urine.
Yes, very good, very good. The, microscopic or gross hematuria, okay? Microscopic, from the term itself, microscopic means what? Can you see with your naked eyes? Can you see with your naked eyes? What we do with the microscope? From the term itself, microscopic means what? Large, or small things that we cannot see with our naked eyes. Small particles or the large particles? Anyone? हम लोग माइक्रोस्कोप में माइक्रोस्कोपिक में क्यों पार्टिकल्स देखते हैं? Why do we observe? Why do we observe some of the specimen in microscope? Why? Because we cannot see with our naked eyes, right? Next point is microscopic or gross hematuria. Microscopic or gross hematuria. Here, what happened is that microscopic and gross hematuria is when a person can see the blood in his or her urine. Means like the meaning is that suppose you pass a urine, okay? You pass a urine. While passing your urine, you can see that blood is present in your urine, and that particular term is known as gross hematuria. That means which you can see with your naked eyes. That is why this term is gross. And the next term is microscopic hematuria. Microscopic hematuria is when a person cannot see the blood in his or her urine. Understand? Yes or no? Yes or no? Say fast, hurry up. Yes or no? You understand? Srijana, you understand?
Yes, ma'am.
Okay. All of you response clearly. Microscopic and gross. Anyone have any questions? Darshana, you have any question? Darshana, you have any question?
No, ma'am.
Okay. Marcy, tell me what is microscopic? What is the difference between microscopic and gross hematuria? Marcy, tell me what is the differences between microscopic and gross hematuria?
When a person can see the blood in his or her urine, and microscopic hematuria is when a person cannot see the blood in the urine.
Yes, very good. Okay, that was the third point. Now let's come to the next point. That is the frequency of micturition. That means you have to assess the frequency of urination. That means like, you know, like what happened is that in urinary tract infection patients, like it is like that like some of the patient might frequently pass the urine, like continuously pass the urine, and some of them they pass small amount of urine. That is why like frequency of micturition is very much important. These are needed to be assessed. So this is the clinical, the fourth clinical features of urinary tract infection. That means passing frequently means a patient must pass frequently, or else he might pass a small amount of urine. Understand? Understand? Yes or no?
Yes.
Okay. If you want response, I will just send the notes in PDF and done. Okay, next is urine that appear cloudy. You know, everyone knows now what is cloudy. What is cloudy? Ishan, do you know what is cloudy? What is cloudy?
Ma'am, cloudy. Cloudy.
Srijana, what is cloudy?
Ma'am, bubble.
Who's that? What is cloudy? Cloudy, cloudy, cloudy. You understand now what is urine that appear cloudy means our urine, when you pass the urine, it is very clear. It's not it. If there is normal functioning of your kidney, what happens is that you pass urine normally. So your urine is very clear. And when your urine is not that clear, it's like bubbles type formation that is known as like your urine appear cloudy. Understand? These kind of symptoms, clinical feature, you will see in urinary tract infection patients. Understand? Understand?
Yes,
Understand?
yes, ma'am.
Yes, ma'am.
Okay. Next is strong smelling urine. You will find a strong smelling urine. Strong, in simply, you can also write, you know, unpleasant odor. You can also write unpleasant odor. There will be, means the urine that you pass now, or the urinary tract infection patient, if he or she pass the urine, then there will be an unpleasant or smell of urine. And that particular time, in simpler, you can call it as unpleasant odor. Odor. Clear? Clear?
Yes, ma'am.
Yes, ma'am.
Okay. These are very, very simple odor. Odor का मतलब क्या है? Odor means what? Odor means smell. So unpleasant means बहुत like ganda smell, as strong smelling urine ऐसा होगा. These are the like 6 points till now we have discussed. Do you have any doubts? Do you have any doubts from these 6 points? Or we'll move on?
Move on.
Okay. Let's move on. Number 7. 6 points. You want more clinical features or 6 points is enough? See?
Enough.
Obviously. Okay. That was the clinical features. Everyone is clear, right? Okay, let's move on to the diagnostic evaluation. Diagnostic evaluation. Okay, first of all, like now suppose a person suffer from urinary tract infection. Now it's your duty. How will you know that he or she suffer from urinary tract infection? Now we need to diagnose. First of all, urine dipstick. We have to take the urine dipstick may react positively for blood, WBC, white blood cells, and nitrates indicating infection. Means like there is a urine dipstick, okay? Then that dipstick might find, may react positive. But how will you come that in that urine dipstick means like there is a positive reaction? How will you come to know if there is a presence of blood, WBC, and nitrate? And if all these are present, that indicated there is an infection. This is how you can diagnose the patient. Next is, first was by using urine dipstick, okay? And the next is by using the urine microscopic. Like in diagnostic, how can you evaluate is that in urine microscopic, in urine microscopy means if you check that urine in a microscope, then you will find that there is a presence of RBC and many white blood cell per field without epithelial cell. Means there won't be the presence of epithelial cell. So this is urine microscopy. Next is, first is urine dipstick, which may react positive if there is presence of blood, WBC, and nitrate. And that will indicate that there is infection. From that, you can diagnose. Again, by urine microscopy, you will find that there is a presence of red blood cell. And then again, many WBC per field without the presence of epithelial cell. This is the second point. Next, there will be a urine culture. Don't get confused, okay? This is the urine dipstick, this is the urine microscope, and the next one is the urine culture. Urine culture, why urine culture is done? Urine culture is mainly done, it is done to detect the presence of bacteria. whether bacteria are present or not. Before I have already discussed now in etiology that E. coli, all those are the bacteria that cause the urinary tract infection. So by doing the urine culture, you can detect that whether there is a presence of bacteria or any other antimicrobial sensitivity testing is also done. It can also be done. Antimicrobial sensitivity testing can also be done. Actually, this antimicrobial sensitivity test is like, it's not necessary in all cases. Like, it's not that if a person suffers from urinary tract infection, so you need to apply this diagnostic evaluation method. It's not like that. That is why here I had mentioned that, however, it is not necessary in all cases, this urine culture as well as the antimicrobial sensitivity test. This is the third diagnostic evaluation. The next is, let us discuss the special investigation. What are the special investigation? Okay. Srijana, you can take the attendance. The time is running. It's only 5 minutes left.
Okay, ma'am.
Cystogram. The cystogram. This is the first, this is the special investigation that you can also do in order to diagnose the urinary tract infection patients. Cystogram. What is cystogram? Like, cystogram means like it is one kind of procedure, okay, which demonstrate the urinary bladder. That it show here what happened. It will show the shape and position of the bladder, and in children, it can also be used to demonstrate if reflux is occurring. Like, reflux means what? I already explained. Reflux, Samuel, reflux. Reflux kya tha? Reflux. Reflux. What is reflux? Shital, what is reflux? Sleeping? What is reflux?
No, ma'am.
What is reflux? क्या था? कुछ flow back explain क्या था ना मेरे पहले? Something. What did flow back? The urine was you were supposed to urinate, isn't it? But you can't. It will flow back towards what? Towards the kidney. Understand? There was reflux, which I already explained. So ये cystogram क्या है? ये एक procedure है, which demonstrate our urinary bladder. Rifan is joining now. Seriously? She don't know the time. This girl. It will show, if you do cystogram, here it will show the shape and the position of our bladder. And or बच्चा में क्या होता है कि children में, like it can also be used to demonstrate if reflux is occurring. Reflux means backward flow of urine. Understand? Backward flow of urine from the bladder. From the bladder, it was supposed to flow to the urethra, isn't it? But still, it won't flow. Instead, it will reflect backward to the kidney. That this is the special investigation that you can also do in order to diagnose the urinary tract infection patients. Okay, next is ultrasound of the whole abdomen. Ultrasound to sabko pata hai. Like, you can also do the ultrasound of the whole abdomen in order to diagnose the urinary tract infection patient. Okay, next is IVP. IVP ka matlab hai ki I stand for IV stand for intravenous and P stand for pyelogram. Intravenous pyelogram. This intravenous pyelogram is like, it is like a type of X-ray. Understand? That will look at your kidney and your bladder and the duct. That is ureter. Understand? All these are the investigation that can be done in order to find out that whether a person is suffering from urinary tract infection or not. This IVP, don't get confused. I can also give you in the fill in the blank, write the full form of IVP. Don't get confused. IV means intravenous, P means pyelogram. All these are a type of X-ray that look at your kidney. हमारा kidney को जो देखते हैं, bladder को जो check करते हैं, और जो duct है ना, ureter, ये सब organ को check करते हैं. Then that particular investigation term is known as intravenous pyelogram. We will be discussing till today. Tomorrow I will be completing your management of urinary tract infection. Tomorrow I think I have 2 classes. I have at 10:15 to 11:15, as well as again I have at 3:15 to 4:15, I guess. Do you want to take the class on 3:15 or morning itself? I will continue. Tomorrow, do you want to take the class at 3:15 tomorrow? Or I will be continue at morning?
Continue in morning, ma'am.
Okay, okay, okay. Do you have any doubts? All these are the evaluation, you know, the point that you need to by heart. Tomorrow, after completing the management, I will be giving you all this in PDF so that you can write down, and after you join, after your reporting date, I will be checking all these things. Okay, let us rewind back. Anyone have any doubts? Clinical feature, all this? The screen is visible to everyone, right? The screen is visible, right?
Yes.
Okay, okay.
Yes.
If you have any doubts, today we discussed about the clinical features as well as the about the diagnostic evaluation. In one day, I don't want to give you all so many because you won't even understand. Only 1 minute left. Any question? Any question, anyone? Oh, okay, 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 okay. Srijana done attendance?
Yes, ma'am.
How many of you are present? I think 27 of you are present, right? I think 27, nah, along with you. 27?
I'm 26.
26. Yeah, I can see the participant as 27.
Ma'am, including you, it is 27.
Oh, okay, 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 okay. Okay, okay. Okay, then. That's all for today, okay? Thank you, everyone. Enjoy your day.
Thank you, ma'am.
Thank you, madam.